some of this is horribly severe, but what you're looking for is any kind of weird stuff. Like this particular one is a good example where you're starting to see some different looks just in the coloration, where you lose hair on the skin, just anything that mainly what I look for is coloration changes and for the hand to look weird. I mean, just that they're holding it weird. Or the ankle. Notice how this ankle has completely twisted. I mean, this is probably stage 3 actually. This edema that needs to be fixed. What would they do with that kind of edema? What would you do with this? You might do some massage to get it out, and then you put a compression hand glove on them. So that would be what you do with that. But you definitely want to address this. Here's some other examples. Look at this. See the difference in these two? It's just kind of an overkill of the inflammatory type stuff going on. See, this is not severe, but it could turn into severe, so you want to address it for sure. This is a good example of just some weird stuff that you'd see, just the different discolorations. And the nice thing is with the foot and the hand is you have both to look at, right? So you can because some people have weird looking hands anyway, or weird looking feet for sure. Just going to see if there's anything else that, this would be a very severe case here. And it's just, what would you do? If this person came into you like this, what would be the first thing you do? The sad thing is I don't think that gets rid of their pain. Y'all realize that amputations don't usually get rid of pain. That's why they don't amputate very often. Normally that pain remains with those people that are horribly in pain. Occasionally you'll see them amputate. We had a guy here in Poto that did a lot terrible damage to his brachial plexus to his arm, and it was causing him so much pain that they finally amputated it. They amputated it all the way to the humerus was completely amputated, and he actually has done a lot better, still deals with pain, but normally it doesn't get rid of the pain.
Do they call that phantom pain?
It's phantom pain, yeah, but they might even keep all this pain they're having with this if you amputated below the knee. And I'm not sure they'd ever be able to wear a prosthesis, but maybe they will. We don't, you don't know, everybody's different. What you would do with this if it came in, I would look at getting it into a pool. I'm assuming that it's healed. It looks like she had some type of ankle injury, maybe ankle surgery. I would get some kind of compression garment on it, but I'd be very careful that it would not be too tight. I would look at doing some massage. I get them into the water and start trying to get them to move. And definitely, I put that foot in the weight bearing. It would have something on it all the time so that she would feel something on the bottom of that foot.
What are you talking about with phantom pain? You're just imagining the pain?
No, it's called phantom pain because that extremity is no longer there. These people don't have phantom pain. We were talking about an amputee.
Yeah.
And so the extremity is not there, but they still feel that extremity there.
Wow.
So they would still feel the hand and they would still feel the pain in the ankle. They might even, and the funny thing is, they can scratch like an area where the amputation is, and they'll still feel their toe.
Wow, that's crazy.
That's phantom sensation and phantom pain. We'll talk about that more with amputees. But they don't amputate these very often. Anyway, there's some pictures of that. Any questions about it? The main thing that we want to do as therapists is to stop it at stage 1. If you see it, I'm going to tell you what we deal with now more than anything else is that, how long does a doctor spend with the patient?
Not very long.
Maybe 10 minutes. So if they miss it and you catch it, you might say that guy's bled. It's very important for you to recognize this.
The difference between type 1 and type 2, I don't understand. I mean, it says following an injury, orthopedic, but not a nerve injury in type 1. And type 2 is injury to a nerve.
Right.
I don't understand how they're related if one's a nerve injury and one isn't.
Type 1 is just maybe they have a fractured bone.
Okay,
Type 2 is they actually had some type of nerve involvement.
okay.
Is that,
Yeah, I mean, that's what it boils down to. I just didn't know how they're related, I guess. I don't know.
well, they still get these same type of symptoms, but you
Okay.
didn't have nerve damage with the
Okay.
first one. You just have like a broken bone
Okay,
and probably a lot of tissue damage.
yeah, okay.
Well, and you may have both, and that would then be a type 2, a fractured ankle plus a problem with which nerve down there at the ankle? That would be the tibial nerve, right? Down there at the bottom of the foot, and it turns into the medial lateral plantar. Are we supposed to have a test tomorrow? A quiz?
No.
I can't remember. No?
No.
You're about tested out, aren't you?
Yeah.
I really need you to look at those, because we are definitely gonna have Jeopardy, and it will not be good for you if you haven't even looked at it. So make sure you understand, because this goes right along with it, really, some of the stuff we're gonna do. But make sure you understand that the lumbar plexus goes to the front part of the leg, and the femoral nerve and the obturator nerve. Sciatica does the back part of the leg and everything below the knee. Kind of figure those, it divides into the common femoral and the tibial right behind the knee. And that common femoral divides into the superficial and the deep. Get an idea of where they divide at, and if they go down, tibia goes right down the back of the leg, down to the bottom of the foot, and divides into the medial and lateral plantar. So make sure you look at that. That's actually simple compared to the brachial plexus, by the way. So get the lower extremity down well. Because what we'll do is tomorrow we will go over Jeopardy, and we need to test that next time y'all come back. You'll be off Thursday and Friday.
You talking about neuro?
Yeah, what we'll do is just it's much easier to do this test and just do lower extremity first, and then come back and do upper extremity part of it with the brachial plexus. So I separate those out for your benefit. So you definitely want to do those 20 questions on the lower extremity and have that done, and then it kind of separates it out for you, so we've done that for a long time. So that's how we'll do it. Unless you want to come in Wednesday during PT procedures and take it, so you'll get over it, get it done. Okay. Anyway, we'll do it after we get back. On Tuesday after we get back. Okay. Okay, so any questions about complex?
So why does it happen?
They don't know. It's kind of a sympathetic reflex response. It sometimes happens to people who are more prone to a low level pain tolerance, but you can't, pain tolerance is very different. It is so different. There are those people who have such a high pain tolerance that it's dangerous for them. We had a kid in Worcester about 2 years ago that was roping and cut off his thumb, picked up his thumb and brought it into his mother and said, "Mom, we better go to the hospital." We treated him at Elite after they put the thumb back on. That child never had any pain medicine. So for him to be a roper is kind of a dangerous thing, because that means he's pretty active, but that's when people break their ankle and they don't go to the doctor. So the people do have that those people are kind of hard to deal with, and what you end up doing with them is you hold them back. I've seen doctors who have done surgeries to lower extremities for a patient like that, and they wouldn't let them do anything, exercise for 6 weeks, because they were afraid they were going to hurt it. So pain tolerance is kind of weird. And then you have those people that you think they should not be in pain. It's going to actually happen more to those type of patients that have what we would consider a low tolerance, but everybody's different. We are all different in this room as that what our pain tolerance, what we can tolerate pain-wise. And you'll find that to be true. like a shoulder patient, I'll have one come in, and they have pain medicine the day after their surgery, but they haven't needed any after that. Most people need pain medicine for shoulder rehab for 6 weeks. So, it's everybody's different. Shoulder, what are the 2 worst surgeries, do y'all think? Actually, knee and shoulder. Hip's not too bad. They'll come off that pain med in about a week. But the worst is the shoulder for sure. I'd say shoulder's the worst. And then I think a total knee is pretty bad. I think an ankle would be bad. I don't work with a lot of ankle patients. I don't know why, but I don't do much with them. But knee, I do a lot of total knees, and it's pretty painful for them. So pain tolerance is really kind of an interesting thing. Okay, let's see, I guess we're done with that. We're going on to hand rehab.